Hey everybody, we're going to go ahead and get started. Johnette Jasper is with us today to give the didactic. So I wanted to start with some introductions and then we're going to give her time and then we will end out with the questions and if you guys have any cases to talk about. But let's see. Dr. Soltis, do you mind to start introductions for us?
I'm Dr. Lucia Soltis at Lincoln Primary Care in Hamlin.
Perfect, thank you. All right, and Corey? Oh, we don't have a mic, no problem. Thank you for chatting in. We appreciate you being here. Okay, we have Cam Tworig.
Hi, I'm a member of the population health team for WVU Medicine. I'm a respiratory quality specialist.
Awesome, thank you for joining. All right, and Johnette, do you want to introduce yourself to everybody? Johnette, are you able to hear? Oh, you just dropped off. Okay, we'll come back around to that. Let's see, Mitra, do you want to introduce yourself?
Hey guys, it's Mitra, Project Echo. Thanks for having me.
Great, thank you. All right, and Siobhan?
I'm here. I'm Siobhan Newman, the manager of transplant services at Ruby Memorial Hospital.
Perfect, thank you. So we have a couple people jumping on, and Johnette, it looks like she lost service for a second, so let's try and get her back. This has been the fun part of permanently being tele. Okay, guys, give me 1 second. I'm gonna mute myself. She emailed me and I need to respond to her real quick.
Can you hear me? I can't hear you.
Yeah, hey, I can hear you. I was muted and I was talking.
I'm sorry, I didn't have a mic on my computer, so I had to switch.
No problem.
So my name is Johnette Jasper. I am a social worker with the Heart and Vascular Institute at Ruby, and I'm also the LVAD social worker.
Excellent. Thank you for being with us today. And Trisha, do you want to introduce yourself?
Sure. Wait, can you hear me?
Yeah.
Okay. All right. I'm sorry. I see that I'm showing up as Christopher Budig. I happen to be at my fiance's house, so but I'm really Trisha Petit, and I am an assistant professor at the School of Nursing, and I also work as a casual employee with the HBI cardiac surgery team. So I work a couple weekends a month, although they didn't need me last month since they weren't really doing many cases. And so not sure when I'm going to be back there.
Yeah. Well, we're happy to have you. Thank you.
Thank you.
Yeah. And everybody, I'm Caitlin Ettinger. You get 1 million emails from me a month. And I'm happy to see you all. So Johnette, are you comfortable with me sharing your slides? And you can just tell me when to progress?
Absolutely.
Great.
Okay, so I'm going to be speaking with you all briefly today about social determinants of health and cardiac health in West Virginia. So I'm going to start off by giving you some statistics of West Virginia. So the population estimated as of July 1st, 2019 was 1,792,147 people. Of that, 93.5% were white, 1.7% were Hispanic, 14.1% under the age 65 had a disability. The median household income was $44,921, and the proportion in poverty was 19.1%. Also, the high school graduate rate was 86.5%. Next slide, please. So why are these statistics important? Statistics like age, sex, income, education, where a person is born, lives, works, and plays are all conditions that shape social determinants of health or social epidemiology. Next slide, please. So according to the Division of Health Promotion and Chronic Disease, West Virginia ranks second highest nationally in the prevalence of general health of adults as either fair or poor. 26.3% of the population considered their health as either fair or poor. Fair or poor health was most common among groups of adults aged 55 to 64, those with less than a high school education, and those who have an annual household income of less than $15,000. The prevalence of fair or poor health was highest in Boone, Fayette, Lincoln, Logan, McDowell, Mercer, Mingo, and Wyoming counties. So I was curious as to why these particular counties had higher prevalence. So I looked up some of their statistics. So in Boone County, their population was 21,457 people. Of that, 20.1% are 65 or older, 50.2 were females, 22.5% were impoverished. In Fayette County, their population was 42,406, and of that, 21% are 65 or older, 49.7% were females, and 22.5% were in poverty. And in Lincoln County, their population was 20,409 people, and 19.5% was 65 and older, 50.5% were female, and 23.3% were in poverty. Next slide, please. West Virginia ranked first highest in the nation for the prevalence of poor physical health, poor mental health, and activity limitations due to poor physical and mental health, 28.5% of adults reported that they did not participate in any leisure time physical activity or exercise, which ranks West Virginia 11th highest in the nation. Next slide. Thank you. West Virginia ranked first highest in the nation in the prevalence of heart attack at 7.5% and coronary heart disease at 8%. Seventh highest in the nation in the prevalence of stroke. The prevalence of physical inactivity was significantly higher among females than males. Sorry, I was looking at that. than their male counterparts. The prevalence of physical inactivity was significantly higher in Grant, Logan, McDowell, Mercer, Mingo, Webster, and Wyoming counties than the rest of the state. Next slide, please. According to the 2018 West Virginia Behavioral Risk Surveillance System report, the prevalence of no health care coverage among West Virginia adults aged 18 to 64 was at an all-time low at 9.3% compared to 14.1% nationally. The prevalence of no health care coverage among those aged 18 to 64 was highest in Barber and Logan counties. 19.5% of all adults in West Virginia do not have personal doctors or healthcare providers. 14.6% of West Virginia adults could not afford needed medical care within the past year. 21.4% of adults did not have a routine checkup appointment in the past year. So West Virginia, of course, is very rural. And one of the barriers we run into a lot is a lack of transportation, which of course poses a barrier to healthcare access. So if a patient has Medicaid, they are able to use Medicaid's contractor, which is Logisticare, for transportation. However, they contract private citizens to use, of course, their private vehicles. So it's not always reliable. And because we get a lot of referrals from the southern part of the state, which, you know, it could be a 3 to 5 hour trip one way for a person. So oftentimes we run into people who don't want to make that drive. So we have patients who do what they're supposed to do, book their transportation within 7 days of their appointments, and then they're waiting and no one ever shows up. So, I mean, it's good to have. It works better for our local patients, but it's private citizens, so it's just not the most reliable service. So there are no other insurance companies that offer transportation services, but the senior center, they provide local transportation to doctor's appointments, of course, but that's just for seniors, and not all our population is seniors. Another barrier we run into is prescription coverage. So a lot of our patients are either uninsured or underinsured. So with our Medicare patients, a lot of our cardiac medications as well as our pulmonary hypertension medications are very costly. So the higher the medication, the quicker it puts a person into the gap coverage period. So when a person goes into that period, then they have to meet their deductible, which is in the thousands of dollars. So during that period, they are responsible for 100% of the cost of their medication, which most of them cannot afford that, being on fixed incomes. So we try to utilize patient assistance programs through the manufacturer, as well as, we have some foundations that we can use as well. And WVU also has a foundation that, we've been blessed to have donations, and we oftentimes use our donations to assist patients in certain situations. And we also assist with transportation. We have the ability to give out gas cards in certain situations. However, if a patient doesn't have a vehicle, then that gas card is null and void. So we have to come up with very, very creative ways and try to, network with different companies and, just to try to make sure that we're doing our part to combat, the barriers that continue to persist with healthcare access. But that concludes my presentation. And if you have any questions, please feel free to ask.
Thank you so much. That was wonderful. Very enlightening. I think we all are are worried, of course. We had a couple questions or comments come in. Corey, yeah, the unemployment rate is very high in all of the counties that were also mentioned in that capacity.
Yes.
And then Trisha, I think, had do we have any information about telehealth and using this for the patients we can?
Using what for the patients?
Telehealth.
We do use telehealth. So we've been doing telemedicine for, of course, since COVID, but they're now starting, because it's working so well, then they're going to start utilizing it more for patients that are not higher risk to come. And we have been trying to work with local cardiologists, for them to see patients. Like Dr. Sokos, he's been traveling the state, meeting different cardiologists, trying to have some type of parameter set up for patients who just can't travel so far. But yes, they have started using telemedicine.
Nice.
Mm-hmm.
If I might just ask a follow-up question to that. So, telehealth has just grown exponentially during this COVID-19. And I was just on another virtual meeting this morning, and they were talking about, the strides that telehealth has made in the past, 2 months since all this started, is normally would have taken 2 to 3 years. And then a lot of people, wouldn't have bought into it because it's just new and people like face-to-face. But, I think going forward, our world is going to look so different, at least for the next couple years. And so, I think telehealth is a great vehicle to see these patients, like you said, who aren't as high risk and, don't need face-to-face or even hospitalizations. So I wonder if with those telehealth visits, do you find, since we are such a rural state, is there a problem with connectivity, or do you do the telehealth? Are they face to face through MyChart, or are they just on the telephone?
So we actually have weekly meetings. Our heart failure team, we have weekly meetings to discuss things like this. And the doctors have said that overall it's been going pretty well. Now we do have patients, of course, who aren't internet savvy. So we have majority of the patients have been through MyChart face to face. However, we've had patients, unfortunately, that we do it via phone.
Okay, sure. All right. Well, you know, most people at least have a smartphone, and so I don't know how well, like, even MyChart would work with a smartphone. I haven't had a telehealth visit myself, but I think it's great, especially for, you know, those people who do have to travel 5 or 6 hours. That's just ridiculous, with no reimbursement for their transportation costs.
Well, you know what, we are really fortunate that we do have funds. So we have arranged hotel stays for patients, especially if they have to come early in the morning and they're coming from far distances. We'll have them come the day before. We'll arrange a hotel for them. If they do have vehicles, we'll give them a gas card. So we try our best to accommodate them. We try not to make appointments like early in the morning for patients who have to travel far.
Right.
You know what I mean? So we try to accommodate them as best as possible.
Nice. Okay, very good. Well, I enjoyed your presentation very much. Thank you.
Thank you.
Thank you. To follow up on that, what would you suggest? So a lot of the people on the call are primary care providers. They don't normally work, well, everybody sees, you know, the whole spectrum of patients, heart, diabetes, all the range. But what would you recommend when they're facing these challenges and maybe don't have the resources that WVU is fortunate to have?
No, well, I mean, everyone can use for like transportation, you can always call. If a patient does have Medicaid, you can be a primary care physician and try to arrange it through Medicaid. It's limited, you know what I mean? Like, it's limited if you don't have these resources, unfortunately. I mean, I would suggest that you know, for seniors, utilize the senior center for transportation. If you have a social worker at your office, utilize your social workers. I mean, we're able to find stuff when most people can't, or at least people think we can. So I really, you know, you just have to be, if you don't have the funds to give, you just have to try to use the resource, like the Logisticares and the senior center and the patient assistance programs.
Absolutely. No, that's perfect. Thank you.
If you are not affiliated with WVU and you are a primary care physician, like, if we don't have, like, when our patients can't afford their medication and they don't, and they can't get it through the Patient Assistance Foundation, because the Patient Assistance Foundations are based on income. So when they don't qualify that, because unfortunately they look at a person's income and it, you know, on paper it looks like they make a lot of money, but they don't take in consideration on what they expend every month. So we try to utilize the primary care physician if they're not affiliated with WVU, so a patient can get samples through their primary care physician if they can't afford these medications. However, WVU does not take samples, so we aren't able to give them, but we've had a lot of primary care physicians that aren't affiliated with us who have been able to get the samples, and the patients still be able to take their medications when they can't afford them.
Okay, great. No, that's very useful. Similar to medications, we had a question about 340B and how that has that helped, or?
I don't know what that is.
Oh, it's the pharmacy. It's having affordable pharmacy and coverage for prescriptions. So we can talk with pharmacy about that. No worries.
Sorry.
No, it's okay. Yeah, so Glenville and Grantsville have 340B programs. I know a couple of local primary care offices that have pharmacy on site, and basically it helps them be able to distribute medication on site to their
Huh. Oh, that's nice.
Yeah.
And now I'm gonna look into it because I had no clue what that was.
Yeah, I think it has been helpful, but we definitely should talk about it with pharmacy and some other sites about how they've implemented it for sure.
Mm.
Yeah. And then Minnie Hamilton has been using telehealth visits too. Most of those are via telephone, but they've been going pretty well for them. So that's great. Everything I've done lately has been telehealth and teleconference and everything like that. Johnette, I want to thank you again. Does anybody have any questions or comments? You're welcome to unmute yourself or chat in. Is everybody doing okay? Is there anything we can do to help? Yeah, just okay. I know.
I do have something I wanted to ask. So I am getting ready to teach a class on health promotion throughout the lifespan for our master's nursing students. And one of our weeks covers health disparities. And so I just wondered, since you are recording this, if it would be possible for my students to go and look at it for one of their assignments, and if Janetta would be willing for me to do that, or if that's even possible, because I think it fits in so well with what we're learning, what I will be teaching this summer. So.
Well, I won't speak for Jeanette. If you're,
I don't have a problem.
Okay. All right.
You
That'd
are
be
welcome
great.
to show them all of the YouTube videos. If any of them are pertinent, I can guide you towards some of the topics if you have other things you would like to implement them in.
Okay.
I have also, so this is cardiac, but we have other echo sessions in MAT and psychiatry. And so I've provided videos for the online counseling and rehabilitation programs and stuff. So
Right.
yeah, definitely.
Okay, wonderful. Thanks so much.
Yeah, of course.
Well, thank you for having me.
Yes, thank you so much for coming. That was great, and it was wonderful information to get. Does anybody else have any questions or anything you'd like to talk about today? I'm not above calling it a short session. I think it's been a great and an informational session. All right. Everybody have a wonderful weekend. I think it's finally going to be sunny for a minute, so enjoy that. And yes, and we look out for all of the reminders, and we'll talk again soon.
Bye-bye.
Bye. Thank you.
Thank you.